so what is a school-based health center? I really like this graphic, and if any of you have been involved in any of the state informational sessions, they use this as well from the School-Based Health Alliance. But a school-based health center is basically a permanent health clinic that's located at a school, right? And it exists really in partnership with the school itself. And this Venn diagram over here sort of shows that really well, where the school-based health center is located at the school, but only made possible because of agreements and partnerships with the school. The community health center there sort of represents what Lincoln Health's role is in our current school-based health centers. And a really important piece of school-based health centers that make it unique from other clinics that Lincoln Health or other health systems might have is that it's really student focused and community focused. And you'll see later on how that sort of plays out in actuality. And the idea really is that school-based health centers are designed to be where people are at and not expect people to come to us to clinics and improve access and the ability for us to serve people whether they have insurance or not. And we can talk a little bit more about that too, and how Lincoln Health is further developing those programs. So here are our 3 locations. And again, I don't really have super awesome photos of the space itself, so why not share the people, which is a little bit more fun. On the far left here, you might recognize some of these folks from Lincoln Academy. That is actually where we've had the longest standing partnerships, I believe. And Eric, you might have better knowledge. 1998 is what I have in other documentation for when the relationship first began. And there's been a variety of different arrangements in terms of how Lincoln Health staff have participated in Lincoln Academy's school-based health center. But I like this photo a lot because it really shows the different disciplines that are involved, right? So most forward, Heather Norris, who's the licensed clinical social worker, then Jan Yost, both of those folks are Lincoln Health employees, and then the back 2 representing Lincoln Academy's employees, with Robin Henney, who sort of is the person who makes everything tick at the health center, in my understanding. And then Eric Duffy, who you all probably know well at this point, has served in many roles at the health center as the director and staff RN and probably a lot of other things in between. And then on the far right, Ann Barker is the nurse practitioner at the Booth Bay Region High School, and actually is a huge champion of the start of that health center as well. That began back in 2005 when St. Andrew's Hospital existed as a standalone hospital. Leadership there, along with the school leadership, really felt strongly about starting a school-based health center. And I believe Ann Barker was one of those that wrote the original grant to receive funding to start that up, and has served, again, many roles, and now is the staff nurse practitioner as well. And then in the middle, a couple of champions for our most recent addition at Madomic Valley High School and the RSU 40 district just started in 2019. And we started that with the understanding that we were going to have some federal and state dollars through an AWARE grant that actually shortly after we partnered went away in a strange twist of the fact that the feds were no longer willing to give the state of Maine any funding because we were a state that legalized marijuana. So the state of Maine lost out on $5 million worth of funding, which is really, really too bad, but another interesting example of how we sometimes, think we're voting a certain way, and then, there's ripple effects. But so Rebecca Cannon, our social worker, is on the right there, full-time at Madomic Valley High School. And then Linda P is principal and a huge champion on the ground for these school-based health centers. So these are some of the things that school-based health centers do. Again, it's meant to be sort of just like any office that we have here at Lincoln Health. It just is located in a school. But we typically see a lot of well child checks. We used to call them sports physicals. We don't call them that anymore. They're really comprehensive well child checks that allow students to safely participate in sports. In non-COVID times, we're seeing a lot of, mildly sick children, allowing them to stay in school. That got really challenging when, any symptom could also be COVID. And so that didn't happen too much in the recent years. But again, lots of the typical same things you would see in a primary care office, as well as hopefully partners with the school in terms of education and prevention work. I know Jan Yost has been to several of the health classes as of late, and integrating with the school curriculum. Behavioral health is a huge piece of the work that we do. Stephanie Field, who's on the call now and has been with us in a lot of these meetings and in some new meetings that we've just established, behavioral health is a huge piece of the work that we're doing at schools. Health risk assessments, one of the new components that we're going to be adding next year is a new online assessment developed by a nurse practitioner to it's sort of like an app that students fill out and is able to identify risky behaviors in a sort of modality that is easy for them to share information. So we're excited about that. And then the picture here is also showing something that we'd like to certainly get a lot more of is dental care integrated into our school-based health centers. So this is a picture taken this year. So we're happy to report that Booth Bay has only been the only school so far that has had a partnership with a dental hygienist, but we've had to take a 2-year hiatus, but she's back again. And you can see sort of the fact that they have a lot of portable equipment, and they are able to take that on the road and sort of take over one of our exam spaces and do a dental cleaning just like they would in a dental office, as well as certainly screen for any conditions that would require more care and connect folks there. So how do you get to receive care at a school-based health center is kind of in this red box. And again, I'll send you all these slides so you'll have the information as well. But referrals can come from anywhere, and families, kids can self-refer, people can walk in. We do require a registration. We just reworked our forms for this last school year. And we're happy to report that they're now online, so folks can also register online, which is great. And we want people to know that school-based health centers can serve students, but they can also serve staff. And I would say some of our school-based health centers are better about having those accessed by staff, but that is absolutely a goal that it's for the whole school community. So here's just a little bit more information about our 3 locations. They all look a little bit different and are staffed a little bit different, but we are working towards making them a little bit more uniform in terms of, there's a nurse practitioner that is available, and every time a nurse practitioner is there, there's also an MA there to assist them. That's kind of a new model that we work towards. And again, recognizing that this is what we do in our offices, and we want to model that same staffing pattern in our schools. You can see that different days of the week are represented differently in the schools. And again, that's sort of based on student population, availability of space, and sort of just what we've done historically. So Madomic Valley High School has 5 days a week of an LCSW time, but it does also serve the Madomic Middle School, which is on the same campus, same as Booth Bay. where they share a campus with a K-8. So we're actually seeing younger students there as well. Whereas Lincoln Academy is strictly a high school. And so we're seeing just the 9 through 12 population there. And we have different setups as well in terms of Booth Bay is the only school-based health center where we're really in our own space. That is just LincolnHealth, and Lincoln Academy and Madomic were co-located with school staff. So there's advantages and disadvantages in both of those cases, but it looks a little different depending on where you are. This slide was just a little bit of data about sort of what sort of visits we've had so far this year, again, just through August to April, so not including this month. And as you can see, sort of heavy proportional to behavioral health visits. And I think that's for multiple reasons. One of which is that oftentimes we're seeing kids weekly, every other week or monthly. So there's just more visits involved probably with behavioral health visits. And this trend is actually pretty similar to what other school-based health centers across the state. I think there were around 72%, 75% of their visits for behavioral health. Thought it was kind of interesting to see how many return to sports we did this year. So not quite 50, I'm pretty sure in the month of May, we've done a couple more. So I bet we're at 50. That's where we were clearing folks to return to sports after COVID. We also do a lot of well child checks, and you can see that proportion there. I think now it's covered up by my screen, but 79, 78 visits. And then I just put some other examples of what are those other things, just a quick search. These were sort of some of the other items that showed up in our visits. Are there any questions there before I sort of go into the state funding? So this is a state-produced graphic that shows sort of where school-based health centers are located in the state. As you can see, it's very southern focused and certainly does not cover the entire state. You'll also notice that LincolnHealth, although we're represented there and we're a new grantee, we've had these locations for quite some time in most cases, right? We are just only recognized as a school-based health center in 2 of our locations. And that was really a matter of when it came time to apply, we weren't confident that we could apply for all 3 at once. And so we applied for 2. That may or may not change in the future. And we may have 3 school-based health centers and include Lincoln Academy. But really, this is just listing those folks that participate in the state program, which means that we receive funding from DHHS to support the medical care that we're providing. It also means that we're going to be providing specific data to the state and that we have a few community requirements that are different perhaps than what we have done in the past, although not dissimilar to sort of what we're going to be doing in the future as well. You can also see that some of the sponsors are different. So some sponsors are actually school districts. Some sponsors are FQHCs, which are federally qualified health centers. And then some are health systems such as ourselves, LincolnHealth, Western Maine Healthcare, et cetera. So it can look a little different in different locations. This information I took directly again from the slides for the informational sessions that the state of Maine is currently sharing across the state. And essentially, they want to beef up the amount of health centers that they have, as well as what those health centers are able to provide through funding. So $2.4 million is going to be sort of injected into this program over the next couple of years. And as you can see, they're looking to basically double the amount of sites that they have. Currently, that we have 16 sites that are funded through this program. And so they're looking to add another 12 or 15. Generally speaking, these grants come out in 2-year cycles, which is what we're on with R2. So we're funded basically through this year and next year. But I think their real intention is to have it be ongoing funding, because they know that these programs are not necessarily self-sustaining, and they require, in-kind support both from the health system and from the schools themselves, right? So the funding is going to do a variety of things. One of the things that I was pretty excited about when I was on the call is sort of the coordination level that they're looking to do at the state level. So I think those folks that have school-based health centers or have done this work before recognize that one of the biggest challenges is for people to even know we exist and what we do and what's available to them right at school, or how to access it. So I think part of the funding is going to be around their statewide efforts to sort of increase awareness about what it is that school-based health centers do, obviously encouraging more health centers and more schools to participate in the program as well. And I would say even just the small outreach they've been doing about the funding that's coming up has increased people's awareness and interest. Here at Lincoln Health, we've been getting a few more inquiries about, could I have a school-based health center at my school, that sort of thing. So that's that kind of statewide effort, as opposed to individual health centers effort, can really be helpful. And then boost funding, we're certainly excited about this. So they have set aside 3 separate categories that they're looking to give specific funding to existing sites or new sites. So a rural site factor, which is sort of self-explanatory. We want to, make sure that those locations in rural areas have the money that they need. Equity factor, there's certainly a lot of effort to support new Mainers, as well as just diversity in general for equity for folks receiving services. And then dental factor. So again, as we showed, we only currently have limited dental hygiene care at Booth Bay, and we recognize that we really need it everywhere, and that dental care in the state of Maine is severely lacking, and dental care in Lincoln County is severely lacking. So that's something that we certainly would want to seek funding for if given the opportunity. So lastly, I just wanted to explain a little bit about one of the things that makes these health centers unique is that really thinking back about that Venn diagram again, that they want these health centers to really be part of the community, and for it to be a back and forth communication between the health center, the community, and the members within that community. So components that are required by these grants, 2 of which are listed in the first 2 bullets, is a community advisory group. And as you can see, they're asking you to meet 2 times a year, and the folks that are included are listed below. We obviously, like this town hall we were doing long before we had these grants, and I think we're often involved in the community in a variety of ways, both with Lincoln Health and with these school clinics. But there's going to need to be in future years, if we're funded through these grants, more of a formalized structure in terms of getting feedback from students and families, etc. Although we may use some of these town halls to share more information. As I said, that little data that one slide that I shared with you, we anticipate that in the future we'll have more data points to share with you. And then a youth advisory is another requirement in which they're asking you to meet a little bit more frequently, so once a month. And again, I don't have as much knowledge about what Lincoln Academy had done in the past in terms of the youth requirement. I think it was probably more organized on the school level, but Booth Bay certainly had historically had a youth health advisory group that was pretty engaged with the health center itself and meeting frequently. So those are two things that we're going to be starting up again. And many of you may be aware that Lincoln Academy and Madomic Valley have also partnered specifically with NAMI, Maine, the National Alliance on Mental Illness, to form some really robust groups around sources of strength, which is based in a suicide prevention program. So we think we'll be able to utilize those groups too. And again, it's really about a back and forth model, right? Like we want to hear from these groups to find out what are we missing, right? How are people not able to access services, or what do we need to improve? What services should we really be providing? So the last bullet point there is just that we are currently developing surveys. So again, not everybody's going to participate and be part of a community advisory group or part of a youth advisory group, but we might get some more broad feedback through surveys. So Brooke and I are currently working on that. And again, do people even know we exist? And how can we meet the needs of the community? So it really is about partnership. And then last slide, this is one that I have actually started sharing in the LincolnHealth community, and certainly with the community at large, just kind of showing this structure that we've built over recent years. And you all on this call are certainly part of that, right? So at the top, the SHAC group is sort of the host of these town hall meetings. We've been doing it for quite some time now, and it's looked a little bit different depending on sort of the state of the pandemic, or what, how often folks need to be connected with folks like Dr. Russ or with the health system to know what is happening with the RCC testing, et cetera. But we recognize that people need to be connected all the time, and not just around the pandemic. So these three subgroups: the school-based health center clinic operation team, the Lincoln County School Nurse Alliance, which Eric has been very graciously leading for us in the most recent months, but Daryl and Nelson had started that group, and it's been really active and involved throughout the pandemic and beyond, really. And then most recently, the Youth Behavioral Health Alliance group that Stephanie Field, myself, and Brooke Bryant have been leading, and really just recognizing that mental health, behavioral health needs are really need full attention to. And so that group has just been meeting over this end of the half of the school year, but we suspect that group is going to be active again next year. And oops, my arrows went the wrong way. And then really important that it's not just that we're feeding information to these groups are really helping to inform the work that we're doing and the work that the SHAC team hopes to achieve by making our community healthier and having it not be a struggle for people to get the things that they need to be healthy and well. So I'm going to stop sharing. That was the end of the presentation. So I gave you a lot of information there, sort of about LincolnHealth and the school-based health centers that we have currently, as well as additional funding that may be down the road. Happy to answer any questions you may have about school-based health centers in general, or the structure that we've built. And then certainly also happy to entertain any questions you have in terms of any health topic that you want to bring to the group or to LincolnHealth. And hi to the new faces who joined since I was only seeing my presentation. Linda, you may have missed it. You appeared earlier in the presentation even. Just a picture of you and Rebecca.
Amy, Pat, one of the things that I would chime in on was that we had a meeting this morning with our head of school, CFO, and the senior administrator overseeing our school-based health center. And we were doing so in preparation for meeting with you and your team about the first renewal of our memorandum of understanding between Lincoln Academy and Lincoln Health. And, you know, it was reassuring to know that we didn't have to change too much. You know, there really wasn't much there, but there's room for topics to come up. That was really reassuring and whatnot, because as you know, a great deal of work was put into those understandings, and I hope we'll provide some kind of model moving forward for the other groups. But one of the things that we noticed was, as far as, do people even know what we do? We saw a real distinct shift. Our team identified today a real distinct shift between pre-COVID and post-COVID, or pre-COVID and since COVID. You know, pre-COVID, we were making presentations at weekly community meetings. We had students knew that they could come see somebody from Dr. Russ's office at our clinic, you know, and things like that. But really, in a lot of ways, the experience in the community of COVID has kind of cleaned the slate. There are a lot of students who come in and say, what do you mean I can see? I already see Jan, you know, or, you know, what do you mean I can talk to a counselor at school, or things like that. And so it's we agree, absolutely. The LA team agrees absolutely that in the lead up to the start of next school year, to show to parents what a great resource this is, especially with the return to play piece right now is huge for us. You know, we went mask optional, and I'll be honest with you, I was on my phone earlier during the presentation because we're getting slammed. The wave was not on its way down. The wave was still post-April break, and now it's happening, and it's happening in our sports teams, and it's happening to seniors 2 weeks before senior week. And so I have done nothing since April break but deliver bad news. But my true point is the idea, though, that when we have somebody on campus who can do that return to play, who can interface with doctors, who can offer that kind of support, it's such a relief to parents to know that they don't have to call and try to schedule, that we can get a student in, you know. And so in this phase of COVID in school life, I never would have taken this job 6 years ago if it wasn't a school-based health center, the way it was set up. And it's pretty, as somebody who's now been in it longer than anybody who's in the room this morning, and probably me and Lisa are the only ones who've been involved with it the longest to this point. You know, it was 3 heads of school, 4 nurse practitioners, and 2 medical directors that spanned the development of this MOU. It's a really good model. It's really neat. And we talked about the value of the LA model compared to what some other models, in that having the NP on campus all day, even if it's only 2 days a week, but having that NP on campus all day allows that practitioner to just be a part of the culture. Some students connect with me instinctively, some connect with Carrie instinctively, some connect with Jan instinctively. And it's a really unique model, and I'm thrilled to see that the state is putting more effort behind it. You know, I mean, Lincoln Health's been ahead of the curve on this, and it's really great to see how well positioned Lincoln Health is coming into this wave of support. We don't need federal grant money or state grant money as much as other schools need it right now. Our program has been in place, and we have budget lines that have already been dedicated for years, but it's really exciting to see. It's really exciting to see. What I see students doing is they come in and they go, I don't know if I can ask this. And our first response is, come on. I mean, this is you have a health question. This is what we do. And you just watch their anxiety come down, you know, and when they realize they can have a conversation with a medical professional that is completely confidential, except if we fear you're at imminent risk of harm, it's such a resource for teens. It's such a resource for teens to be able to just put a question out there. Yeah, so I appreciate all of the work that Lincoln Health is doing, and that we're all doing to try to make this happen. It's a new territory in a lot of ways, but it's worth it. We've seen some really, it's neat at graduation. I went from emergency care where the gratification was immediate. You got to get the line in, you help somebody, they name their firstborn kid after you, you feel great. But school nursing, as any of us know who have been in, it's, oh, you're back again. Oh, this problem is still happening. Oh, this kind of thing. But then there are those times at graduation where you see somebody going across the stage and you can't help but feel that the healthcare that we provided played some part in getting them there. And that's pretty cool. It's delayed gratification, but the value that comes from these clinics is huge, I think. So thanks.
Yeah, thank you, Eric. And I think it's reassuring to hear in some ways that the work continues, right? That as long you've been there that long and it's still hard to let people know. So yeah, take consolation in that, Mrs. P, is that, right? It takes a long time to get people to know. And even though you've been there, and I do think there is a restart button that we're hitting after COVID, that people need to relearn. The dental program that we had going in Booth Bay was immensely popular. We were seeing 50, 60 kids 2 times a year for both cleanings. And we've recently put out, a lot of information. Mindy, the office staff there, is fabulous and is well integrated into the community, but we only got a few people at first. So it takes a while. And I do think the community groups that we're going to set up are going to be really important, because we don't know what we don't know. And I think it's really important to hear from school staff and from families themselves what they really need.
Annie, how will the survey get disseminated? Did you address that?
No, because we haven't really finalized them, and I think it's going to be on individual school level, right, to decide how they might best do that. And the school year is fast dwindling away, isn't it? And so I don't know if I'll lean on my school partners to say whether it's good to send it out before the end of the year or send it out in the summer. But we certainly want to be on people's radar. And any other questions related to school-based health centers, or just, again, Dr. Russ had to excuse himself. He was double booked. I would say, Eric, we're also seeing a challenging time in terms of testing upticks here. And, it's frustrating, as I said in the beginning, right? We all want to be done, and COVID's not done with us. So again, I know schools have also gotten home tests through the state. LincolnHealth also has access to home tests if you happen to run out and need more. We do have a grant that allows us to order some more, and we're happy to share with schools.
I just wanted to say thank you. We know we have more work to do, but that we're not here to not do anything. So here we are. And so it's just a matter of continuing to build. I don't know about the surveys. One of the challenges that we have is we started our Parent Square program 2 years ago to increase communication. And now what we hear is that it's too much communication. And so people don't look at the announcements. It's hard. I don't know what the answer is really, because it's never does seem right. But I'm not sure if there's any better time than another, except just when we're ready to do it. Seems as though there was something else I wanted to say, but mostly just I think I'm pretty proud of us that we started to pull this off 2 or 3 months before COVID hit, and
Yeah.
we've managed to do not just this, but a number of things we've managed to really plow through by just pure grit in the middle of this pandemic, and still grow with your help. So we're really appreciative, and really the partnership, it was just very good to have the support during the pandemic, because there were so many days when we were just, I don't even know, I can't even describe it. Sometimes it still is those days still are there for us, but it's just been really good. So I'll just stop there and say thanks.
Okay.
Yeah, I think you said it well, right? Grit and determination, and just one foot in front of the other. And I think, that last slide about the infrastructure that we've built has really been key. I think COVID has forced us to really work together in ways that we didn't have to in the past, but I think we see the value in what we're doing, right? Because schools alone can't take care of all of these issues, nor can, we really need schools. You have access to kids in a much different way, to the community in a much different way than we do. And I think this is part of the state recognizing that too, as well as, having access to some funding maybe they didn't have in the past as well. But they fully recognize that school-based health centers and health partnerships with schools are really going to be important moving forward.
I know, I was going to say, I think what I was thinking of is that we obviously received our tests, and you just can never predict. We actually went around class by class during all one period so that we wouldn't miss anybody. And we only had 100 students take them. So now I'm looking back here in this room that's become the COVID room. And now I have boxes of all these tests that people didn't take. And I don't know if it's because they're high school kids and they don't want to put something else in their bag. I don't know if it's because for many people COVID is over, even though it's not. But we still have 300 sets of these 5 test kits, and so we'll continue to try to get them to people. But that was kind of curious to us, but you just can't predict.
Yep. I think it kind of goes full circle. Carol McClure can attest with me too, right? We were so excited when we could order all of our home tests and ordered boxes and boxes, and a lot of them went off the shelves quickly, but then there was a little bit of a stall out, wouldn't we say, Carol, where people weren't as excited to take them.
My office as well, Linda. I have boxes piled almost to the ceiling. Can't give them away.
Well, I have I did a career day up at Mountain View High School, and we gave them away as prizes. Test kit. We were like asking questions, or just like as giveaways. We're like, here's a test kit, here's a test kit. And they're
That's
like,
a great idea.
one.
People love to win stuff,
Yeah,
right?
so
Like if they think it's a prize,
right,
then they're
yeah.
good.
You can't give it away, but make it a prize and someone will be happy to receive it. I think exactly.
And think of how lucky we would have felt to have these tests a year ago, right? I mean, it also shows you what timing can do. All right, so this is the last town hall that we're going to have for this year. We welcome your feedback about hopefully, again, I'm knocking on wood or something, that we won't be in the same situation starting the next school year. But throughout this school year, we tried to have 4 meetings and 1 starting before school so that folks could feel prepared. If you feel like that's important, again, we can stay with that structure. If you feel like we can meet less, or that we need to meet more individually with schools, we're always trying to find that balance, right? Like, we want to make sure that we're listening to unique school or school district needs. And we will be doing that through our school-based health centers. But if the current schedule seemed to work for people, we're perfectly happy to do that again.
I've said many times, Amy Pat, that this is one of the most useful meetings that I go to during over the last couple of years. And I can't support enough the idea of doing another one of these third week of August with Dr. Russ, Dr. DeShane, all of the supers, the principals, and everything. The start of school is only 3 months away, maybe 4. So, but yeah, no, it's a really helpful, it's a helpful meeting.
I find that too. I was sorry to be late today, but this nature of this is that things just pop up. But I like this format as well. And we call it here, maybe, I don't know if you guys do too, but we call it eating the elephant one bite at a time, even if you don't like elephant. And sometimes none of us do, but just knowing that you have a touchstone, even though I don't know all of you personally or whatever, just like there's this group of people that are all doing it too. And so that feels nice. And so I would like to continue the structure. Nothing against elephants, of course. Love elephants.
Okay, sounds wonderful. And thank you again for joining us. I know it's hard with the end of the school year. It's just busy and beautiful days come upon us and people take advantage. But we did record this and we'll send it out and share with your teams as well. And we'll all talk very soon, I am sure. Thank you.